Well, I'm delighted to welcome our next speaker also. This is Dr. Tom Farley, New York City's Commissioner of Public Health. Tom Farley was hardly a household name until this past week. He's now been in every newspaper in the country, every TV newscast, following his and Mayor Michael Bloomberg's announcement that New York plans to limit the sizes of soft drinks sold at restaurants. And that plan is very much in keeping with the previous city actions to mount a comprehensive anti-smoking campaign, eliminate trans fat from restaurants, get calories listed on menus and menu boards at chain restaurants, and encourage companies to lower sodium levels in packaged foods and restaurant foods. Now, before moving to New York, Dr. Farley, a pediatrician, was chair of the Department of Community Health Sciences at the Tulane University School of Public Health and Tropical Medicine. Reflecting his passion for promoting health, Dr. Farley co-authored a book titled Prescription for a Healthy Nation. In 2007 and 2008, he started to work in an official capacity to move towards that healthy nation. He served as senior advisor to New York City Health Commissioner Thomas Frieden, and in 2009, he became the health commissioner of New York City when Dr. Frieden went to the Centers for Disease Control. So, Dr. Farley, how's your last week been?
Thanks very much. First, I'll have to say I'm honored to be on the same podium with Mayor Nutter. Those of us who are in health can generate great ideas, and most of the great ideas in this are generated by people in this room. But when you really get action, it's when an elected official comes out there and really champions that cause. And if you look around the country, for the most part, elected officials are hesitant, some might say timid, because there are enormous pressures on them to not take action on things which have some vested interests. And so it really takes enormous courage for an elected official to do this. I am very much a supporter of the elected official who is my boss, Mayor Bloomberg, but I have to recognize Mayor Nutter being a true leader who deserves all the support we can give him for the courageous things that he's done. And then also, just want to thank you for, you, Mike, for putting me on the agenda at short notice. You would think that we had timed this right, but it certainly wasn't planned to have our proposal come out this close to the summit, but the opportunity is great. What I want to do is take you through our proposal for reintroducing what I would call human-sized portions in New York City. Before I get into the details of that, I'm going to just ask for your forbearance a little bit because I want to give you a little bit of background. Much of this background has been generated by researchers in this room, but in case there's any press here who don't know this background, or if anybody came here for a real estate conference in the hotel and walked into the wrong room, I want to give you a little bit of background. First, in New York City, we've worked hard over the last 10 years to reduce smoking rates. And we've succeeded, as you can see in this graph here. And if you wonder why it is we're turning our attention now to obesity, I think this is the simplest way to display this to people. This is, if you look at the red line, it's our obesity rates by telephone survey by year over the last 10 years. And so that's an underestimate of our actual obesity rates. We're probably closer to 30% right now, but continuing to rise. And another 35% or so are overweight. This also says something about the potential here, because before 2002, smoking rates had been plateaued at 21% for about a decade. And then when my predecessor, Tom Frieden, came in, with Mayor Bloomberg, decided to really take on tobacco, he demonstrated that it can be done. Smoking rates have fallen by 35% in New York City. That means 450,000 fewer smokers. So if we can do that with a longstanding problem like tobacco, we can certainly do it for obesity as well. I want to talk about why we care so much about obesity. It's not because people who are obese are unattractive. It is because people who are obese suffer. And so I want to just give you some of the numbers for that in New York City, the magnitude of the problem. We estimate 5,800 deaths per year attributable to obesity, of which 2,000 occur before the age of 70. $4 billion, that's 4 with a B, in medical costs. And the disease that is most closely linked is diabetes, of course. Now 1 in 8 adult New Yorkers has type 2 diabetes. 1 in 4 has prediabetes. 2,600 hospitalizations for amputations. 1,400 people each year go on dialysis for diabetes-related end-stage renal disease. And that commits us to about $80,000 per year per person for healthcare costs. There's a lot of things that have contributed to obesity, but clearly the rise in calorie consumption is undeniable. And this is the best simple way to demonstrate this. This is the food disappearance data from the USDA. And it's just worth pointing out here that people don't have adequate access to fruits and vegetables, and we need to do more to give people access to fruits and vegetables, and we're doing a lot in New York City to do that. But that's not going to solve this problem. We need to have people consume fewer calories, particularly of those things which seem to have grown during this time in order to solve this problem. And the background here, again, that's been generated by many of the people in this room, of the way that we think about the connection between sugary drinks and obesity. Roughly 200 to 300 more calories per capita per day based on dietary surveys over the last 30 years. Of that, maybe 120 or so of the calories increases from sugary drinks alone. So that means maybe a third to even up to a half of the increase could be explained by this one product. If you just calculate out the calories, one 12-ounce can is enough for 15 pounds weight gain a year if that's added to the diet, which it often is with sugary drinks. And we now have good long-term observational studies in the association, as well as some randomized controlled trials. Is it important in New York City? Well, the simplest way I can try to demonstrate that is this. This is from our telephone surveys, where we can show that there's a strong correlation between consumption of sugary drinks at the neighborhood level and obesity rates at the neighborhood level across the city. Strong correlation, as you can see here, with the R value. And it occurs across all the 5 boroughs, from that which has the populations that are most wealthy in Manhattan to those of the poorest in the Bronx. So this is not adjusted for anything. This is just a simple correlation, but it's amazing how strong it is. Then the issue of portion size. There have been, as everyone probably in this room knows, a large number of studies that are remarkably consistent about the relationship between portion sizes offered to people and what people consume. They're somewhat disconcerting, to be honest. We think of ourselves as thinking, conscious beings. We make decisions. But in fact, the data seems to show the opposite, that people consume things without knowing it. If you give people larger portion size, across the range of studies, maybe 20 to 50% more consumption. The really funny a study on self-refilling soup bowls, and many of you people here probably know about that. Essentially, the people will eat 73% more, not have the slightest recognition that they're eating more. And then the last one here was a more recent study where people were given larger portion sizes over a period of 11 days, larger foods as well as larger beverages, and they just simply consume more beverages without compensating for it by reducing their food consumption immediately or over the long term. So it's not so much that people are unthinking, it's that people are preoccupied, is the way that I look at it. We all have many other things and problems to deal with in our lives besides thinking how many calories we're taking in at that moment. And that's the nature of being human. We have to accept that. And that's the biologic backdrop, and then here's what's changed over time. This is the growth of the Coca-Cola portion. For decades, a 6.5-ounce contour bottle was the standard, and people thought was perfectly acceptable. I actually remember as a child that some of the parents of friends of mine couldn't quite finish that 6.5-ounce bottle. They would put a little plastic cap on it and save it for later. It's kind of hard to imagine now. So from there, it grew to the 12-ounce can in the 60s, then the 20-ounce bottle in the 1990s, and then the 1-liter bottle in the late 1990s. And they've grown not just, if you haven't seen this, I love it. This is in the Coca-Cola Museum in Atlanta. I assume it's from the 1950s. It is actually a real advertisement, which demonstrated that 16 ounces, the cap that we're talking about in New York City, used to be enough for 3 people. So if anybody thinks we're being overly harsh and saying you can't have more than 16 ounces, just remember that. The fountain drinks have grown, if anything, larger than the bottle-sized drinks. So this is just a range of what we can get in New York City right now. The one on the far right, 64 ounces, that's a half a gallon. I would describe that as a tub, not a cup. That has, depending on the packets you use, that could be up to 64 packets of sugar. It's enough that it gets kind of heavy when I carry it around for these multiple interviews, so that the fountain drinks are huge, and they have grown demonstrably over the years. This is Lisa Young's work showing that when McDonald's opened in 1955, the only portion size you could get of a sugary drink was 7 ounces. Since then, they grew, and they peaked in the early 2000s, where you had an option between a 32-ouncer and a 42-ouncer. Since then, they've shrunk a little bit, and they have introduced some smaller portion sizes. That's a good thing. On the other hand, their smallest size now, which is labeled as a, quote, child size, is 12 ounces. That's almost double what the only size was in 1955. And it doesn't need to be that way. In case you haven't seen this data, this is data from McDonald's around the world. It's a global company, and their portion sizes in Europe and in Australia are substantially lower than they are in New York City. There, what's called a large size is what's called a medium size here, and those companies continue to be profitable. They're growing, and people are, if you notice, a little bit less obese in those countries. The idea of portion size as a problem is not new. For the last decade, there have been health officials and others who have called upon the restaurant industry to serve people smaller portion sizes, ranging from Michelle Obama to the Keystone Forum to the Surgeon General, but the portion sizes remain huge. So what exactly is our proposal? The proposal is that there would be a cap on the size of sugary drinks at 16 ounces at food service establishments. That would apply to a cup that a restaurant would give you. It would also apply to a manufacturer packaged product, like a glass bottle that you might get at a deli in the refrigerated case. And it would exclude beverages that don't have calories. It would exclude any that have fewer than 25 calories per ounce. It would exclude pure fruit juice and dairy drinks. And it would exclude alcoholic drinks. But so it's really focused very much on the sugar water, what is clearly the core of this connection between beverage consumption and weight gain. There would also be a maximum size of 16 ounces for the cup if you're at a self-service restaurant where you go to the fountain and you can fill it up yourself. Because if you say you're having a diet drink there and you get a 32-ounce cup, well, then you can just obviously fill it with the sugary beverage. And it's worth remembering here that customers who want more than 16 ounces can purchase more than one portion. This has been presented as being pretty heavy-handed, as somehow that what we're doing is to customers to saying no. In fact, this is really just providing a default maximum value for a portion, which people then can choose to change. So the way I look at it, it's not saying no to people, it's saying, are you sure? Do you really want that? It's sending a message while giving people the freedom to drink as much as they want. The rule would apply to food service establishments in New York City, of which we have 24,000. That includes chain restaurants, QSR chains, and table service chains, independents. Snack bars and movie theaters and stadiums in New York City are food service establishments. If they are chains, they currently have calorie labeling. They also have letter grades for their sanitation, so you can recognize them in that way. It would also apply to mobile food vendors. If you've been in New York City, you know we have food carts and food trucks, about 5,000 of those, and so it would apply to them as well. Now, it would not apply to grocery stores, supermarkets, and mini marts because New York City doesn't regulate those. Those are regulated by the State Department of Agriculture and Markets. As you might imagine, the beverage industry doesn't like this very much. And so they've taken out full-page ads in the New York Times making a few claims, and I thought it would be worth just laying out here what the claims are and what the responses are of us to those claims. First, that sugary drinks make up only 7% of the diet, and that's probably about right, but that ends up being about 140 calories a day, and if that is added to the diet, then that could be as much as a 15-pound weight gain over the course of a year. And as people probably in this room have demonstrated, that sugary drinks tend to be added to the diet because they don't cause a sensation of fullness. The second is the the sugar from soda has declined by 39% since 2000. If you're talking about soda alone, that's probably true. Some of this is a shift, though, from carbonated beverages to sweetened teas and fruit drinks and that sort of thing. And I have to point out from time to time, it's not the bubbles that have the calories, but the overall, although there has been some consumption and some reduction in total sugary drink consumption over this time period, it's still far higher than it was in the 1970s, before the obesity epidemic really took off. Then there's been a 24% reduction in the average calories per serving. That's kind of an odd measure, but that's put in the claims. What matters is not the average calories per serving, but the total calories per capita that people consume. And now we're probably at about 140 calories per capita per day from sugary drinks, which is still plenty, as you can see based upon the bullet higher. And that food is the #1 source of added sugars in the American diet. Well, it depends on how much you group or split, but sugary drinks are responsible for about 40%, maybe a little more, of added sugars in the diet. So it's the single largest item and certainly a major, major contributor. Then the obesity epidemic cannot be reversed by reducing sugary drink consumption. Well, nutrition experts from 4 leading institutions, which many of them are probably in this room today, have come up with very clear statements that they think that reducing sugary drink consumption is important to preventing obesity. And just to give you the sense of this, if we could reduce obesity by only 10% in New York City, that would save about 500 lives a year. Now, that's more than we have in homicides each year in New York City. When you think of how much resources we put into reducing homicides, which I support and think we should continue to do, it does seem like that this is something that's worth putting in some resources and some policies as well. It's also worth pointing out that there's no major problem we have that is going to be solved by one simple policy alone. And it's ridiculous to say that we shouldn't try something that's going to only solve a portion of the problem. And then there's government is overreaching. We hear this a lot, but it's just pointing out that that's what they said when we banned lead in paint, when we banned smoking in bars, when we banned trans fat in restaurants, when we required calorie labeling, all those innovations starting in New York City. And I feel, and I think probably most of you here feel as well, that government has a duty to respond to a crisis. So finally, I thought I'd just finish by some pictures. This is, unfortunately, today what we've become used to seeing. This is what people are as normal today. Normal is not healthy. And in case you don't know what they look like anymore, this is what healthy children look like, what healthy children are in the minority now. This is what children look like. So let me just finish with the thought that there's innovation that occurs at the local level. There's innovation that we can support. There's innovative ideas here. New York City has gotten recognition for innovation. But innovation really happens when you have an elected official who is willing to speak out and say that they're willing to make policy change. That doesn't happen easily. Mayor Bloomberg has the courage to take on policies that he thinks will save lives, even though he sees them as controversial. And so we are very optimistic about where this is going, but we need your support. And the people in this room are really the national experts on obesity. And so I'm asking you today to speak out and communicate in any ways you can, verbally, in writing, in talking to your colleagues, and talking to your local elected officials, and talking to the press, to make the case, if you think it's true, that this rule that we're proposing here, that it's important, that it's fair, and that it would be effective. And I'm confident that if we can do this, and we can continue to work together on things like this, that eventually all of our children in America will look like that. Thanks very much.
Thank you very much, Dr. Farley, for the talk and for everything that you and your colleagues have been doing in New York City. And Mayor Bloomberg is certainly gutsy for moving ahead with controversial measures like this. We have some time for questions, don't we? Okay.
Go ahead.
Hi, I'm Dr. Pamela Peake, WebMD. A quick question. In all these years we've been talking about the bans and the taxes and back and forth. People have talked about the issue of how we're going to actually implement this. And good grief, does this mean we have food police now? So as you look at all of these establishments across New York, one of my favorite cities, I'm thinking about what if someone shows up with a 20-ounce cup or whatever else. This is an interesting question. It's been posed by a large number of my people on the diet community in WebMD, which represents 90 million members. Mm-hmm. And so I'm going to pass it along to you. How is this going to be implemented?
We inspect restaurants in New York City, and depending on how they're doing on their sanitary practices, we're in those restaurants between once a year and 4 times a year. And so we will simply add this to be one more thing that the restaurant inspectors will look at when they're there. And I actually think it will be implemented and enforced fairly easily. I think of restaurants in New York City as being in 3 general categories. We have the chain restaurants, which tend to have very large portion sizes, and these are big national companies, and they're not likely to have, as a matter of policy, go against what the law is in New York City. So I think that they would come into compliance, and so I don't think enforcement would be difficult. Then there are independent restaurants of the sorts that you and I probably would go out to for dinner, and in some sampling we've done in New York City, the vast majority of those already don't serve portions above 16 ounces, so we don't need to do much with them, don't need to do anything with them. Then there are the corner delis and the pizza places where you go in and there's a refrigerated case and they have the sugary drinks. They're generally selling about 20-ounce bottles and 12-ounce cans. So they're going to have to switch from the 20-ounce bottle to the 16-ounce bottle, which they can do. I don't think it's that difficult. And it's not difficult to verify when we go in to see if they've got 20-ounce bottles in their display cases. All of our inspections are unannounced, by the way. So we think it's going to be fairly easy to implement. Yes, I think there's a...
Jim?
Oops.
Oh, yeah, okay, sorry. Susan Hevey, I'm with Reuters News here in Washington. Just a quick question for you. We had heard about tobacco earlier. Why not take the approach where you could put warnings on, supersized drinks, saying, warning, this could cause obesity? And what about other foods, candy bars, and other things that have lots of calories in them?
2 things. First, we would be preempted, is my understanding, by federal law from putting warning signs on packaged sugary drinks because with the Nutrition Labeling Education Act. And we think for the fountain drinks that this would be more effective than a warning. And as far as other sources of sugar in the diet, we recognize that those are also contributors to obesity. All calories can be contributors to obesity, but there is no single product that has had the greatest increase in portion size or in consumption during the unfolding of this epidemic over the last 30 years as there has for sugary drinks. And there's no product that is as closely associated with weight gain as sugary drinks. So we've clearly identified one major contributor, probably the largest single contributor to the problem. We think it's appropriate to tackle that.
I'm Jim Krieger from New York City, not from New York. Well, actually, I was born in New York City, so I always think of myself as a New Yorker, too.
That's right.
Not Philadelphia, sorry. But the question I have is you put out a call for support for New York about being fair, effective, and important. What would be the target audiences to receive that message from other cities and places around the country? Who needs to hear the message that we support what you're doing?
You know, I think that there are many audiences. I certainly think your own local elected official is important. I think the press is important because then they amplify it and get it to others. National elected officials and elected officials in New York City may hear about it, should hear about it from people around the country as well. But let me just say, if you communicate your support in writing to our office, we'll help circulate that.
Great. Well,
Okay.
thank you so much, Dr. Farley.
Thank you.
You know, the only way